Hello, and welcome to A Crosstalk, a series hosted by Renew America Together, focused on fostering bipartisan dialogue, encouraging civil leadership, and healing the political divisions of our current American society. Renew America Together is a 501c3 established to minimize the effects of divisive rhetoric through bipartisan dialogue and education. My name is Lincoln Zaleski. I'm a disinformation specialist at Renew America Together and the host of A Crosstalk. This is the 6th episode of our series. I'm joined today by Claire Viscione, research assistant at the American Institutes for Research, and Tori Fessenden, a program assistant at USAID's Bureau for Global Health. Claire and Tori, welcome to the show. I'm excited to have you both on. To kick us off, could you guys introduce yourself to our audience and give a brief backstory on how you got involved in either global health or in public health?
Sure, I can kick us off. Thanks for having us on today. So my name is Tori Fessenden, program assistant at USAID's Bureau for Global Health in the Center for Innovation and Impact. During undergraduate, I did not study public health or global health, but I majored in economics and international affairs, and my concentration was international development. And throughout my development courses, global health was stressed as a major component of everything we were learning. So when I got the opportunity to work at USAID in the Bureau for Global Health, I was super excited to learn more about this field, and it's been a really great opportunity for me since then.
Hi, my name's Claire Viscione, and thanks, Link, so much for having us here today. As you mentioned, I'm a research assistant at American Institutes for Research, primarily work on health and education projects. I initially became interested in public health during my time in undergrad. I was involved with an organization that provided health education to rural communities internationally. And since then, I've been able to explore the field of public health through various different domains, whether it be clinical research, working on health policy, or data analysis, and have been interested ever since.
Well, that's great. Despite your different backgrounds, you both have an exciting path that's led you here. So some of our members of the audience may be wondering, why is an organization dedicated to bipartisanship and civic engagement talking with two public health policy professionals today? And the reason that I wanted to talk to you both is twofold. So first, at Renew America Together, we recently hosted a bipartisan discussion about vaccination through our Civility Leadership Institute between the CNN medical correspondent and the Fox News medical correspondent. And we wanted to have some younger voices heard as well through a crosstalk. And second, we talk a lot about disinformation on this show, and with all the falsehoods surrounding the COVID vaccine rollout, I wanted to talk with people who have worked in the past with some of these large-scale rollouts of medication in other countries that may not be as receptive to it. So kind of broad strokes here, what types of challenges do you encounter in vaccine campaigns, like the one that's currently being rolled out in the US?
Sure, I can speak a little to this. I think in the areas that USAID works on, which is primarily lower and middle income countries, a lot of the challenges with vaccine or medication rollout include just funding or infrastructure challenges. That can include the lack of health services in hard to reach populations, or a lack of manufacturing capacity to produce either vaccines or other equipment that goes along with it. So those aren't necessarily issues in high-income countries like the United States, but there is one issue that we see across all income levels, and that's vaccine hesitancy. Vaccine hesitancy is defined as the delay in acceptance or refusal of vaccines despite the availability of services. It can be super context-specific, changes throughout every country, in every region, every country, and it's influenced by factors like complacency, convenience, and confidence. I think we're seeing all of those factors play out in vaccine rollouts throughout the world, including the United States. And in the US, I think specifically the confidence in the efficacy and safety of the vaccines is a major issue. But something we also see as a challenge throughout country or income level is the way that social media plays an influence in vaccine hesitancy. And it's been identified as a major driver of misinformation and the lack of confidence in vaccines, especially government-sponsored ones.
It's something that I've recognized through my work as well. One of the major new additions to all the vaccine plans and the vaccine rollouts that we've seen locally in the United States is they all now have a section dedicated to disinformation and social media. So it's definitely been a component that we've recognized here as well as disinformation researchers. Claire, for you, as a follow-up, do you feel like this vaccine hesitancy that Tori described globally is in the United States itself and is also fairly normal or expected for Americans.
Yeah, I would definitely say that it is very expected for Americans. The vaccine or anti-vax movement started many years ago. Initially, a little over 20 years ago, there was a study published linking the MMR, measles, mumps, rubella vaccine to autism. And although that study was unable to be replicated, which in clinical research is a key determinant of accuracy and validity of a study, it was pulled from the journal that it was initially published in, and the doctor was shunned by the medical community and removed his license for the amount of disinformation that he was spreading through that particular study. It did kind of spur this anti-vax movement that we've seen over the last decade or so, based on that piece of disinformation that really kind of spread like wildfire, I think, through different communities throughout the United States. So given that kind of history of anti-vaccines, I think that it was very expected that now going forward, there's been COVID vaccine hesitancies.
So you guys have both identified a number of problems, mostly with disinformation, that public health policymakers face both abroad and in the United States. So let's talk solutions. If you were President Biden or you were a policymaker at the CDC, what additional steps would you take to protect the American public from both the virus and false information about it? And Tori, do you want to take this one first?
Sure. I think as we've talked about, social media playing a huge role in spreading a lot of these fringe ideas on vaccine misinformation. I think a pillar of any sort of public health advocacy needs to be education and targeting a campaign of positive information about the vaccine, spreading the facts about the efficacy and the safety of it. I think it's proven a huge challenge in the United States to try and regulate any of these social media companies and trying to get a handle on the misinformation. So I think just keeping that in mind, also launching an educational campaign to make sure that people have the tools that they need to identify misinformation and to trust the information that the CDC is releasing and the FDA is releasing and all of the public health experts are talking about when it comes to the strength of these vaccines and why it's so important for us to get it.
Yeah, and similar to what Tori mentioned with social media, I mean, we've seen a lot of vaccine campaigns with the White House and influencers, pop stars, just people trying to kind of target younger audiences. And I think that's really important. But also, I think we need to really consider interventions at the community level when we talk about education, because in social media, there's a lot of echo chambers and you have a lot of people sharing similar ideas with one another. So it can be very difficult to kind of break through those walls at times. And so bringing it back to the smaller level, making sure we kind of have on the ground interventions and person to person education, I think is also really key, especially in kind of trying to talk to people who may not be as open to it and really engage in a productive dialogue. I think that sometimes on social media and on the internet, it can be very easy to not listen and just kind of share your own perspective. But I think when you're in person and on a much smaller scale, those education campaigns can be really effective as well. And with maybe older generations who aren't as into media as well, that could really benefit from the vaccine especially.
I think you're both definitely right. I know at Renew America Together, we try and foster this kind of civic education, civil engagement, these kinds of campaigns that you're describing. I think a lot of the vibe in the United States amongst people who really believe in the vaccine is kind of just throw up your hands and say, I don't know what to do about these people who don't believe in it. All the science points to, obviously it works. And what we really need is what you guys are describing, which is reaching out to these people who are hesitant about the vaccine, who are concerned, and trying to educate them as best you can by having these dialogues and discussions like we're trying to have today. So switching gears a little bit, has COVID-19 changed the way that you guys personally think about your work as public health professionals? Or is this just kind of a similar situation that you encounter, but on a larger scale and at home?
So I think that this has definitely changed the way that I think about the work that we do in terms of whether or not this is a situation we've encountered before. I'd say that when I joined my team, I was really surprised about how much experience everyone had had in various other epidemics, and like the Zika and Ebola epidemics that my team had responded to before. And so I was very surprised when they started talking about COVID differently. And I think that's when I really knew that it wasn't going to be like anything we had encountered in our lifetimes before. I think something that changed my personal outlook on the work that we do is when I was able to work on the COVID response. And it really just opened my eyes to everything that goes on behind the scenes in a massive humanitarian crisis response. I think we learn about it in school and our undergraduate studies, and we hear it talked about on the news, but seeing what really goes on behind the scenes in terms of not only just the funding aspect, but all of the logistical aspects, especially when you're dealing with that in the place that you work too, dealing with an epidemic or pandemic in your place of work and responding to it overseas. I think I have a newfound respect and understanding for what it takes to respond to a humanitarian crisis.
Yeah, I mean, as Tori said, it was something unlike what we've seen in our lifetimes. On one hand, people know what public health is now, and when I got my degree in public health, not a lot of people really quite knew what that meant. Although a lot of my extended family was like, "Oh, epidemiology," in response to, of course, the epidemic. But I do think that it's really publicized the field of public health, unlike has ever been done before in the field. There's a saying that you know that public health is working when you see nothing, or it seems like nothing's kind of happening. And I think that obviously the COVID-19 crisis has brought a lot of visibility to public health, and hopefully encouraging more funding and more experts, and also a lot more of an interdisciplinary approach to public health as well. Aside from, the medical community, we also have people who are experts in data and people working in education and kind of cross-sector involvement in public health that I think was kind of missing a bit before the COVID pandemic. And so I think that is really going to change the field in a big way. And hopefully in my work, I would love to kind of bridge some of those gaps that I think might be existing and help work with those partnerships to get public health to where it's going.
Yeah, I think both of those answers really show the kind of depth and breadth of this pandemic and its uniqueness. It's not to be taken lightly. It's not really to be compared of anything that's happened in our lifetimes. So thank you both for sharing that. So our last question is always the same. If there is one policymaker or civil society figure that you admire or you try to emulate, past or present, who would that be? And Claire, you want to start?
Yeah, sure. So I think kind of on trend with today's discussion, I would say Dr. Fauci, based on not only is he kind of just like become this public health hero in a way over the past year and a half, but I think his ability to really communicate across different audiences and do that effectively makes him kind of a big power player, and something that, especially when we're talking about bipartisanship, can be a very, very rare trait to have when it comes to health communication and relaying information. That kind of translational research has been huge in the field of public health, and being able to kind of discuss science into practice and how it can be used and taken up at the community level. And so I think his ability to do that is incredibly impressive.
So when I was looking into some public health or global health figures that I thought were interesting in the field, I came across one story of a not really a public health expert at all, but her name was Ruth Coker Burks, and apologies if I'm pronouncing that incorrectly, but she became prominent a bit in the 1980s during the AIDS crisis, where she was trained as a real estate agent, and her story started when she was visiting a friend in the hospital and saw a patient dying of AIDS. And the nurses in the hospital were very hesitant to treat him, and the man's family had abandoned him. And she, in that moment, knew that she needed to do something or anything for him. And she sat with him in the hospital for 13 hours while he passed away. And from then on, she dedicated everything she could to supporting AIDS patients, especially terminally ill ones, bringing them to doctor's appointments and medication and fundraising, eventually even burying them in family cemeteries where funeral homes wouldn't accept them. And I think her story is really, really inspiring in just the sense that we all need to have a little bit more empathy and compassion if we have nothing else to give. So especially now during this pandemic, you don't need to be a public health expert to contribute to making people's lives a little bit better, trying to help each other out. Just trying to be compassionate where you can really, really go a long way in just even improving one person's life. So I think that's, and really inspiring story that I came across, and I think it's a message that we could all do a little bit more with.
Both great answers. Thank you very much for sharing. And thank you both for joining the show. It's been great chatting with both of you. We're looking forward to our discussion about the vaccine at CLI, and your insights today have taught us a lot about the vaccine and vaccine hesitancy as well. Stay tuned for coming episodes of A Crosstalk next month. Feel free to visit Renew America Together's website for more information about bipartisanship and healing American divisions, as well as research about disinformation campaigns and voter fraud. As always, if you enjoyed the video, please like and subscribe for more bipartisan conversations. Thank you both.